Hi everyone, this is Yasmin from SAE Media Group's Biosensors for Medical Wearables conference in partnership with Medical Design Briefs. This year's conference is taking place on the 24th to 25th of October in Boston, and I'm delighted to be joined today by our conference co-chair, Dr. James Mault, founder and CEO of Biointelligence and board member of the American Telemedicine Association. Dr. Mault will be joining us for a few sessions throughout the two-day conference and leading the full conference as a co-chair. And Dr. Mault will be presenting on medical grade wearables and continuous remote monitoring from in-hospital to the home. And will also be joining us for a couple of panel discussions on decentralized trial design, the future of medical wearable biosensors, and the clinical value and utility of advancements in remote care technologies. We're so pleased to be joined by you, Dr. Mault. Welcome.
Oh, thank you so much, Yasmin.
So, Dr. Mault, we've got a few questions for you today to introduce you to our attendees for the conference. And I guess to get started, we've seen a lot of developments and advancements in recent years in the landscape of medical wearables and digital therapeutics. From your perspective, what would you say are the biggest developments from the past year?
Well, it's a pivotal moment in probably the history of medicine, and what we're seeing is a 100-year-old practice of traditional healthcare, which was facility-based, and it was very manual in nature. In other words, 70% of healthcare costs, certainly in the United States, are labor expense. And every other sector of our economy, of our society, has moved from labor-intensive services to technology-based, automated, services. When you talk about the airline industry or the banking industry or even the shopping industry, and so healthcare has been the last holdout, and now we are faced with crushing labor expense because of labor shortages of healthcare professionals and people quitting and retiring after COVID burnout. And so now what you're seeing is this forcing function to move to patient monitoring and data capture using wearable technology. So the wearables actually have started to have a lot of opportunity, but at the same time, historically the wearables have been for the most part one-trick ponies. So what I think you're seeing now is the preeminence of a new generation of medical grade wearables. That's one key differentiator. Is there's been a lot of consumer wearables that were great for fitness and exercise and wellness, but now when you're talking about taking care of sick people and making life and death decision, the wearables have to be medical grade, FDA, clinical accuracy, reliability, shock testing, heat testing, and they need to be multi-parameter. It's having a one-trick pony that measures one thing would mean you'd have to have 5 or 10 wearables in order to collect the various parameters that matter in the care of patients, both in the hospital and now at home. And that's the other dimension to this is the need to be able to get people out of the hospital sooner and be able to monitor them in the home setting. And there's a huge shift right now from facility-based care to home-based care. Some forecasts as much as $250 billion of economics is going to shift from facility-based care to home-based care, which inevitably begs for multi-parameter medical grade wearables in order to collect the data that's necessary to enable those people to be cared for in the home setting. And then lastly, and certainly not the least, is the continuous nature of these multi-parameter wearable devices that allow us to be able to see trends in longitudinal fashion and be able to identify problems earlier in their course so that there's an opportunity to intervene and prevent a high cost rehospitalization or transfer to the ICU or even visit to the ER. So it's a really exciting time. Couldn't be more excited about this conference to be able to bring people together and talk about exactly what's happening right now, because over the next couple of years, everything is going to be changing, and a lot of it has to do with the simplicity and the cost effectiveness of continuous medical grade multi-parameter wearables.
Thank you, Jim. Well, so much going on in the industry, and like you say, now feels like a turning point where everything is advancing so quickly. And I think the key focus that you mentioned there is that it's the medical grade data that we're getting from these wearables, rather than the developments we've seen in fitness tracking and things like that. It's the opportunities for the medical industry and pharmaceutical industry that we're seeing there. Go ahead, Jim.
Well, and I'm glad you alluded to that. The one other critical aspect of this is, now that these multi-parameter continuous medical grade wearables are creating all this new data, the mistake would be reverting back to traditional labor to watch all of this new data. That's the mistake. So the real power here is the combination of continuous multi-parameter medical grade wearable and all this new data bundled with algorithmic exception-based monitoring that allows this to be very, very scalable. So by taking all this data and running it through algorithms that are computer-based and cloud-based, then those algorithms can watch the data actually better and with more, I would say, fidelity than even human, traditional based monitoring. And those algorithms can then watch all these different parameters in statistical trending, and then serve that up to the clinicians in a scalable way. So now we're talking about being able to flip the cost curve and be able to take better care of more patients at a fraction of the cost, and really making clinicians that much better. These are tools. This is not a threat to clinical practice. It's not an either or proposition. The high tech does not preclude high touch. What we wanted to be able to do is use tech to be able to monitor large populations of patients and then show you, out of this population, here are the subset that need that high touch attention of a healthcare professional. And that's where it gets really exciting, because we as healthcare professionals want to spend more time on the patients that need our attention. And that's what this does. And so it's really important to talk about not only the exciting wearables, but also the data science and the clinical intelligence that makes the new data from these wearables scalable and more effective in the care of patients.
Absolutely, and I know on day 2 of the conference, we're looking a little bit more at the algorithmic side and the AI side of collecting this data. And in your panel discussion as well on day 2, Dr. Mault, the clinical value that we can get out of these, moving a little bit further down the line. I guess on a final note, from your perspective, Dr. Mault, why do you feel it's important for the industry to be joining us for this year's conference?
Oh, as I said earlier, this is the moment. This is really the breakout moment that we will look back on the history of medicine and say, in these few years, healthcare, came into the digital age. I mean, I think the mistake is saying, oh, when we move to the electronic medical record, that healthcare, entered the digital age, and that really isn't the cold-hearted truth. The truth is, we didn't change the way we practiced medicine. We simply had an electronic way to record what we are still doing in a very antiquated manual practice. What we're talking about now is very different. We're talking about a complete, I would say, renaissance in how to take better care of patients with better data and the ability to have systems that are now showing. We know that, for better or worse, AI assisted radiology is better at picking up masses with cancer monitoring, and we know a number of aspects of care are now getting better because we have better data, and then we have clinical intelligence engines that are reducing post-op MIs and reducing post-op renal failure and reducing length of stay. And that's where we all want to go. So thank you. We couldn't be more excited and looking forward to seeing everyone.
Thank you so much, Dr. Mault. Well, can't wait to hear more from your sessions, from all of our speakers. A reminder, the Biosensors for Medical Wearables Conference will be on the 24th to 25th of October in Boston. If you'd like to hear more details on the event and take a look at the full program, head to the SAE Media Group website, and we hope to see you all there. Thank you, Dr. Mault.
Thanks so much. Bye-bye.